So tonight we're here to celebrate One Health Day. One Health Day is officially celebrated on November 3rd, but I don't like to work Saturdays, so we're here tonight. But actually, we have a One Health conference that AMC hosts for veterinarians and medical professionals that's happening this Saturday. So last year's One Health Day across the world had more than 110 events in over 30 countries, so it is growing, and we are part of that here at AMC. This year we're talking about One Health and infectious diseases. So it was a natural choice for this lecture because infectious diseases really do cross human, animal, and environmental boundaries, and we'll get to hear some great perspectives from that tonight. So I'm really pleased to have with us 4 distinguished guests. We have Dr. Phil Fox as our moderator. We also have Dr. Sally Slavinski from the New York City Department of Health and Mental Hygiene. We have Dr. Paul Callie from the Wildlife Conservation Society and the Bronx Zoo, and Dr. Ellen Carlin from EcoHealth Alliance. All of our panelists are veterinarians, but they have unique perspectives and their work contributes to One Health in different ways. So I'm just going to quickly introduce our moderator, Dr. Phil Fox. He is a staff doctor. He is head of cardiology here. He's also director of the Casbury Research Institute and educational outreach for veterinarians. He received his DVM degree at the Ohio State University, and he's a well-recognized international speaker and has won many honors, including the North American Veterinary Conference Speaker of the Year, Distinguished Alumnus Award from Ohio State University, Daniels Award, Award of Merit from the NYPD, City of New York for research to identify health risks in police dogs at and following the World Trade Center 9/11 terrorist attacks. He was past president, American College of Veterinary Internal Medicine, Cardiology Specialty. He has published extensively, including 2 cardiology textbooks, and is one of the founding editors of the Journal of Veterinary Cardiology. He's a popular lecturer at professional state and national veterinary conferences on topics related to coughing, heart and lung disease, new diagnostic methods, and effective therapies, but tonight he'll be moderating our One Health panel. So just for the structure for tonight, we're going to open it up to a brief panel question. Each of our panelists will talk for about 15 minutes about their own work, and then we'll bring them all back together to ask them a few questions before we open it up to the audience. So thank you very much. I hope you enjoy the event.
Without addressing One Health in its entirety, we're kind of not doomed, but we're doomed to follow the footsteps of things that didn't work. Animal Medical Center's interest in that also involves possible collaboration with colleagues such as our speakers to look for opportunities to serve animals and people, and we do that through collaboration, and it all involves the environment. We all do research in different ways. Research can be molecular and fancy, or it can sometimes be what's the weight of the dogs in the One Health room, you know. So what our panelists will cover are things that they've been involved with, and part of this is synergy. So there's no question that's a bad question, and we hope you'll be involved at any time. I think if anyone has questions, you can raise your hands, and if we can deal with them without disrupting, the vibe of the panel is terrific. If it's going to be something that might come together after they've all spoken, then we'll do it that way. So without further ado, our first panelist, is it Sally?
Yeah.
There you go.
So thanks, Dr. Fox. Thanks, Jackie. Thanks to AMC for inviting me here today. I'm going to cover a lot of ground, so I'm going to go through this fairly quickly, and I'm going to read from my notes so I stay on track and don't go over my 15-minute quota here. But I do want to tell you a little bit more about some of the One Health work that's done here in New York City at our health department. You're going to be hearing pretty soon about some of the fascinating work that my colleagues do. My day-to-day work may seem a little bit less glamorous. When I try to explain what I do to my friends, sometimes even my family, I kind of get a glazed eye, sometimes a head bob. But I'm going to point out some of the more exciting outbreaks that we've worked at, so you get a real true sense of the One Health work that we do and a lot of the collaborative work that it entails. It is surprising that a lot of people are surprised to hear that a veterinarian is working at the health department. But I just want to give you a sense overall of what we do at the health department. Similar to other local and state public health agencies, we're tasked with monitoring and describing disease burdens in people. We also call this surveillance. We have a public health lab, and at that lab we can offer specialized testing. We're the only lab in New York City that can do rabies testing, and for a while we were one of the few labs that could offer Zika testing. We do a lot of outreach and education, also often driven by our surveillance data. We partner with other agencies, organizations. We use our data to develop policy, the no smoking ban, the calorie count postings, and we write and enforce certain laws and regulations such as rabies vaccination for dogs. And then as a veterinarian at the health department, I'm in the zoonotic influenza and vector-borne disease unit, where we oversee surveillance and conduct investigations for zoonotic diseases such as rabies, leptospirosis, influenza, and then those diseases transmitted by ticks and mosquitoes, so things like Lyme disease and West Nile in people. And we've also made some animal diseases reportable to the health department, and we are tasked with liaisoning with other agencies and organizations that deal with animal health in the New York City area. And for this, collaboration is key. We regularly work with our partners in other parts of the health department, especially environmental health, as well as other city, state, federal, and global agencies and organizations. And New York City is not alone. I will say most states and large city health departments also employ a veterinarian whose role is similar to mine. And I feel like in this role and setting, One Health can be more easily defined and implemented. It's something we've been doing for years, and most veterinarians have been doing for years. In my role, we're identifying and responding to zoonotic and vector-borne diseases. Often it's diseases we already know about, but sometimes it's new or newly emerging diseases. So as I said, we're going to keep it interesting, and I'm going to go over some concrete examples of a few of the outbreaks that highlight the One Health work that we do at the health department. So we're going to start with rabies. Rabies is a viral zoonotic disease, and this is a map that's showing the animal rabies cases in the U.S. And you can see all along the Atlantic coast, we're in a pretty hot spot. And this is because the rabies virus has adapted very well to raccoons, and so it's efficiently transmitted from raccoon to raccoon. Our public health lab began rabies testing in 1992, and that's when this virus first appeared in New York City raccoons. The virus has also adapted well to bats, and every year we find rabid animals in New York City, and every borough has been affected. And we use this surveillance data and the rabies test results to help inform decisions on whether to administer rabies shots to persons and pets who may have been bitten by a potentially rabid animal. So to date, we've had over 600 animals test positive for rabies, mostly raccoons and bats. And then we've had other animals, skunks and a variety of other things that have become infected, and these are animals that have become infected because they were bitten by a rabid raccoon or possibly a bat. And then looking at the boroughs, Bronx and Staten Island report the largest number of rabid animals. But you might also notice that Manhattan has this big number here, 160. And that can be explained by one large outbreak that is reflected in our surveillance data. You can see here in 2010, this is all due to a large outbreak that we had. So this is a map of Central Park, and it shows all the rabid raccoons that we identified during this outbreak. So these are raccoons that we found mostly in Central Park, but also around Central Park. And each dot represents one single rabid raccoon. And we had a total of 148 raccoons that tested positive during this outbreak. Previously, we really hadn't seen rabid raccoons in Manhattan, and we were worried because Central Park has an abnormally large, very dense population of raccoons, and so we were worried that this virus was going to spread rapidly through the raccoon population. There's a lot of people that visit Central Park on a regular basis, and a lot of dogs that visit Central Park on a regular basis. So we really wanted to work quickly to find partners to help us vaccinate raccoons to prevent further spread. This outbreak definitely received a lot of attention. I don't know if any of you remember it when it happened, but the Daily News had a field day, as well as a lot of other news outlets. very similar to the distemper outbreak that's occurring in raccoons right now, which the media has termed the zombie outbreak. But we worked very closely with our partners at USDA, Parks Department, the Central Park Conservancy, and we would set traps at night in various areas of the park. And then the next morning we'd go back and see if there was any healthy raccoons present in the trap, and if there were, they were given a rabies shot and given an ear tag, and they were released back into the park. And we also worked with Dr. Calle and his group at Wildlife Conservation Society. We used the response as an opportunity to conduct a health assessment of the raccoons in Manhattan. So what we were able to do is take a subset of the raccoons that were trapped, anesthetize them, and then collect blood and other specimens so we can evaluate those raccoons. And we continue to work with USDA and parks on a project with Cornell to vaccinate raccoons using an oral rabies vaccine that was developed specifically for raccoons. So there's a liquid vaccine, and it's placed in these little packets that are kind of like ketchup packets, and then they're covered with a fish meal bait. So they smell really stinky, but the raccoons love them. And then you put them in these bait stations, and we put these throughout areas of Brooklyn and Queens, so you can see all the little dots that show where the bait stations are. And then on Staten Island, we use a low-flying helicopter and distribute it that way across the island. And that's been helpful in immunizing raccoons and reducing the spread of rabies in those areas as well. So animal bites are a reportable condition to the health department, and this allows us to follow up with the bite victim, veterinarians, and animal control to determine if we think that rabies shots might be needed based on the type of the animal that was responsible for the bite, and whether the animal is available for observation or testing. Most animal bites in New York City are due to dogs. Oops. Oh, I ruined it. I ruined the surprise. So most of them are due to dogs here, followed by cats, as well as a variety of other animals. But you can see in this table, we had a tiger one year. This was a person who illegally purchased a tiger cub and raised it in a small Manhattan apartment. Small, cute tiger cubs grow up into beautiful, large tigers, which this cat did. And neighbors started complaining about the urine stench, the odd sounds coming from the apartment. The bodega nearby couldn't figure out why he kept buying 20 chickens at a time every day. But it was when he was bitten by the tiger and went to an emergency room and sought care that an investigation began. So he seeks care. He tells the doc, "I was bitten by a dog." The doc was like, that is not a dog bite. So we had folks go out, and sure enough, there's a tiger in the apartment. And so the question is, how do you get this tiger out? So I think we consulted with you then again to figure out how NYPD could tranquilize this tiger. So apparently this cop, who's part of NYPD's ESU, Emergency Services Unit, was tasked with this, and so he said this was one of the scariest jobs he ever had, because as he was climbing down, this tiger kept lunging at the window, and all there was this little barrier between him and the tiger. But he got the job done. They went in, they were able to rescue the tiger, and of course they found an alligator in there too. I don't know the size. Did you know?
Is the apartment available?
Oh, the tiger had his own bedroom, yeah.
Is it a controlled apartment?
So now we're going to move on to leptospirosis. So this is a bacterial zoonotic disease that's found in New York City. It also has a global presence. And infected animal hosts can shed the bacteria in their urine, and transmission occurs through contamination of an open wound or mucous membrane contamination. So disease is similar in people, and dogs get this as well. Most infections are probably asymptomatic, but there's a smaller number who go on to develop severe illness, and that can include liver and kidney failure. In New York City, our human surveillance, we find 3, sometimes more human cases a year, so not a lot. But we also, this is one of the reportable animal diseases, so we investigate probably between 10 and 30 canine cases each year. Probably underreported, there's probably more, but those are the ones that we find. In New York City, rats tend to be the primary reservoir of this bacteria. and are the source of infection for almost all of our human cases. And then human and canine cases tend to occur sporadically, so one here, one there. We don't often see clusters, but one year, a couple years ago, we did see a cluster of 3 human cases, which is very unusual. All 3 cases lived on a single block in the Bronx. 2 were employees at a live animal market, and the 3rd was a resident of an apartment building that was close by. And the block was a designated rat reservoir area, so it was known for a lot of rat activity. And when they went on site to investigate, it was clear that there were infestations in both of these buildings. This also got a lot of media attention, and we ended up sending out health alerts to both human health providers as well as to veterinarians. We have a system where we can keep veterinarians in New York City aware of public health events that are concerning for animals as well. And these are just some photos of the investigation or the inspection. You can't really see all that well in the back, but just evidence of a lot of rat droppings in these locations, lots of garbage being left behind, which of course is a huge attractant for rats. And then these portals that allowed rats to get in and out of the buildings. So a lot of work was done by the health department to help reduce that burden there. All right, so now we're moving on to flu, another viral zoonotic. So birds are host to almost all known influenza A viruses, and sometimes these viruses can infect other species, and we might see large pandemics when a new flu virus is introduced into a naive human population and gains the ability to be readily transmitted among people. And we saw this happen with H1N1, swine flu, many years ago. So cats normally are not infected with influenza viruses, but a few years ago, there was a sick cat in the city shelter system that tested positive for an influenza A virus subtype H7N2. And this was very odd, and it actually set off alarm bells for USDA and the New York State Agriculture Department, and that's because this virus really had only been seen before in poultry on farms, poultry in our live bird markets in New York City, and the last time it had actually been detected was over 10 years prior in 2006. The virus seemed to be spreading pretty rapidly through the cats in the shelter system. So the big question we had was, now that this virus, this bird virus, is in cats, has it mutated or has it changed so much that it can now be readily transmitted to and among people? Could it be the next pandemic? And it was winter at the time of detection, so there was a lot of regular flu going around and a lot of sick people to help complicate things. But what we were able to do is within 2 days we set up a pod and we tested the shelter workers and the volunteers at the shelter. We called hundreds of people who had adopted cats to identify anyone who was sick and have them tested. And through all that, we actually found one positive, one person who tested positive, and that was a veterinarian who was actually working with a lot of these sick cats and collecting oral swabs at the time. And the vet's illness was very mild, lasted a couple of days at most, but nobody else, so that was a huge relief for us. During this outbreak, the entire city shelter system was on hold until ASPCA came in, and it was great. They were able to put together a quarantine facility in a warehouse nearby, and so over 400 cats from the city shelter were moved to this quarantine facility. They had volunteers come from all over the country and care for these cats, veterinarians and just general public to provide some kind of care. And after several months, all the kitties were fine, and they were adopted out. And because of this quarantine facility, it allowed the city shelter system to, depopulate, clean up, sanitize, and then reopen for business. Because during this whole time, they could not do any kind of taking in of cats or adoption of cats. Oh, and this is just one of the volunteers working with some of the cats in full PPE. And this is just kind of an interesting side note. So, in human disease, we have a formal disease surveillance system in human health. We can tell you how many cases of measles we have every year. But nothing like this exists for companion animals. So again, we can tell you how many cases of Lyme disease, how many cases of measles, but we can't tell you how many cases of feline leukemia are diagnosed. And during a recent outbreak of canine influenza in New York City, And this is a flu virus that is not known to be transmissible to humans. We used our expertise in surveillance to work with the New York City Vet Medical Association to put together a web-based reporting system. And this would allow vets to report their cases online and keep track of the outbreak. And so we would go in each week and we would take the data that had been reported and we could generate these case counts so they could look at cases over time that were occurring in New York City. And then we also developed these maps that would show which boroughs were affected. And then if you would roll over the borough, you could see how many cases were counted for that borough. And it seemed to be very popular, so we're going to see if we can implement more of these for other animal diseases. Okay, moving on to tick-borne diseases. So tick-borne disease is typically maintained by some kind of animal host, and then the ticks are responsible for then transmitting from the animal to humans. And several tick-borne diseases are reportable to the health department, which allows us to identify who's getting infected and risk factors for infection. So why are folks getting infected? We also do tick surveillance. So we go out into the field and actively try to capture ticks. It's not so hard. And then we identify what kind of ticks we have, monitor their populations over time, and then we can even test the ticks to see what kind of pathogens they might be carrying. So this is showing the number of cases of Lyme disease over time. And I don't know if you can see, but the numbers are highest among Brooklyn and Manhattan residents. And from our interviews, it seems like most of these cases are people who are leaving New York City. They're not getting it in Manhattan and Brooklyn. They're leaving New York City, going upstate, going to Long Island, getting infected there, and then coming home and getting diagnosed. But when you look at the rates of disease, so this is the number of cases per population, and if we look at that by borough, this red line here is Staten Island. So Staten Island all of a sudden just starts leading the pack. And we think this seems to be correlated to the growing deer population in Staten Island. So deer are fairly good swimmers, and so what may have happened was we had deer swimming over from New Jersey. They did pretty well on Staten Island and kept on repopulating, and the population just has exploded, over thousands of deer there now. Deer are the preferred host of the black-legged tick, which can transmit Lyme disease. So deer don't carry the bacteria, but they just support the adult ticks. They're a blood meal for the adult ticks. So the more deer you have, the more black-legged ticks you can have, and the greater risk for human infection if those ticks are actually infected. So to help manage this deer population, the city has hired a company to perform vasectomies on the male deers. And so these deer are tranquilized, and then they do a quick operation in the field, and then they reverse the tranquilizer, and the deer are free to go. And so my understanding is they've performed this procedure on over 1,000 deer so far, and they think that's probably 95% of the male deer population, so pretty extraordinary number. So we'll see over time if that has an impact, and the hope is that it will. Tularemia, so this is another bacterial zoonosis. This is a disease that can cause a severe, sometimes fatal pneumonia in people. We rarely see human cases in New York City, but we have seen at least one case in every borough. It's certainly more common in the south central U.S., and it's associated with rabbits, and so sometimes referred to as rabbit hunter's disease. We had an interesting case several years ago when a woman from Staten Island, she reported no contact with rabbits. We could not identify anything, but upon doing a pretty thorough investigation with her, we figured out that she must have been infected by an indirect route, and so we think it was her dogs. What we found out was that while her dogs would go on walks in the morning with her dad at these big parks, he would let them off leash, and sometimes they would catch rabbits. And so they would come home after their walks, they'd run upstairs to her bedroom, jump on her bed and lick her face like we like our dogs to do. But she had pretty severe acne, so she had these open wounds. And so we think what had happened was the dogs had killed or mouthed a dead rabbit that may have died from tularemia. The bacteria were just in their mouths, transiently contaminating it. And when they licked her, that's the route of inoculation. We did test the dogs, and both the dogs were positive, though they never did get ill. And then salmonella. So every year we identify young kids infected with salmonella who report purchasing a tiny turtle. These tiny turtles, actually, there's a federal law that bans the sale of these tiny turtles, yet they continue to be sold. We get reports all the time. But we can almost never trace them back to the seller. But one year we actually were able to confiscate a batch of turtles. And they did have a salmonella strain that matched the kid that we had initially identified, as well as several kids in other states. And ultimately that allowed us to do a trace back to a big turtle farm in Louisiana that seemed to be the source of these turtles. And then finally, not so much One Health, but Fun Health. We can also have fun with our data. And this is a map that was made using our dog licensing data that shows the most popular dog names by borough in New York City. Bella and Rocky and Coco and Max are the big ones across all boroughs. And that's all I have. So I don't know if you want to do questions now or wait until after. Okay.
Okay, wonderful. So we're looking forward to your questions, but not this second. So we're delighted to have the next speaker, Dr. Ellen Carlin. Again, Senior Health and Policy Specialist at EcoHealth Alliance. And let's see, the slides ought to be up there.
All right, thank you. Is this working? Thank you very much, Dr. Fox. I appreciate the introduction. Thank you so much to Jackie and the AMC for inviting me here today. I've been to the AMC on several occasions for continuing ed for veterinarians, and I'm really pleased to be here now speaking and speaking with all of you. I think it's really exciting when the general public and the pet-owning public really wants to learn more about a topic that I have been spending my career on, which is One Health. So over the next 15 minutes or so, I'd like to take a little bit of time to talk to you about the ecological and environmental aspects of One Health. As Dr. Fox pointed out, One Health is really about this triad of human health and animal health and environmental health. And at EcoHealth Alliance, we think a lot about the ecology and the environmental elements of health. And so with that, I thought we could first discuss where the environment fits in to that triad. So this is an infectious disease triad that I think any of the vets in the room are familiar with, and maybe some of you as well. It's the host, agent, and environment triad. And so what do these words really mean? Well, the host is a person who might have an infectious disease, or perhaps an animal that might have an infectious disease, or in this case, an animal such as a tick, which we might think of as a vector of an infectious disease. This example will start to become familiar to you as I go through because Dr. Slavinski has just shown us this example. The next variable in this triad of how health is interconnected would be the agent, and all that really means is the microbe, the pathogen, the bacteria, the virus. So in this case, you can see spirochete bacteria, that's just a kind of bacteria. And in this case, these are the bacteria that cause Lyme disease, which we just learned about. And so these are the pathogen that can infect and cause health problems for the host. But all of that means nothing without considering context, and the environment is what really gives us context. So this is a picture of woodlands. You can see a warning sign here that this is probably a tick-infested area. And we all interact with woodlands in different ways. Maybe some of us are gardeners. We spend a lot of time in our yards at that beautiful interface at the edge of the yard, maybe not so much in New York City, but in the suburbs especially, where you have a yard and then you have woodlands, and at that place where they meet, there's just enough light and just enough moisture for grasses and other plants to grow. And who loves eating grasses and plants and flowers? Deer. And so the creation of this environment that I just described in many ways is part of the reason that we've seen more Lyme disease over the years. But what's most interesting to me, the Lyme is just an example, and this is sorry about that. This is a very this is a very simplified cycle of what Lyme looks like, but more to the point, I was always taught host, agent, environment in that order. And I think most of us who went to vet school probably were too. In the pictures, the host is always up on top. We talk about the agent next, and then we talk about the environment last. And I actually thought I was going to be speaking last today, so I'm quite thrilled to be second because that's a huge promotion from third. But if you think about this a different way, you can really turn this triad on its head, and you can put the environment up top. And it really doesn't change the proportion of importance that each of these elements gets, but what it does do is sort of remind us, maybe if we start talking about the environment first, that we can't help human and animal health. We can't mitigate the effects of the agent without really putting it into the context of the bigger picture. So I'm a big proponent of thinking that way, and EcoHealth Alliance, which is, I should have mentioned, we're a research nonprofit based here in New York City. We think a lot about the environments that we study, which are typically not here in New York. Sometimes they're in the U.S., but oftentimes they're in other parts of the world. So the same triad still applies. So we live in a world now in which emerging infectious diseases are really common. Dr. Slavinski just pointed out quite a lot of them. And I think Lyme is a really nice example of that. But I also want to talk about lepto, which you are now all well primed for. And I'm going to talk about it in a slightly different way than what you heard, which is great. We're complementing each other. We didn't plan that, but sometimes things work out. So let's think about the ways that lepto might be a nice example of how we need to consider the environment when we're trying to understand an infectious disease and to mitigate its impacts. As Dr. Slavinski mentioned, lepto is a widespread zoonotic disease. That means humans and animals can share it. It may even be the most common zoonotic disease in the world. It's all over the world. It infects people all over the world. It infects a variety of domestic animals, including dogs. Your dog may even be vaccinated for it. It also infects wildlife and peridomestic animals like mice and rats as well. And it's caused by yet another spirochete bacteria, not dissimilar from the Lyme disease bacteria you already saw. And what's interesting about lepto is that risk of lepto is typically associated with water. I mean, it's transmitted from animal to animal by urine, but sort of environmentally speaking, it thrives in areas that are wet. So areas that are flooded, or where there might be lots of puddles, or poorly drained sewage lines, for example. And so we're going to get back to that in a minute because it's important. But one of the things that's important to think about in lepto is who is at risk and how do they get to be at risk. So healthcare workers are all at risk, and that includes veterinary healthcare workers as well as human healthcare workers. Anyone who works with animals. It could be farmers, it could be slaughterhouse workers, it could be people who own pets, and then of course the pets themselves and livestock and zoo animals. How do these people and animals get to be at risk? Well, we talked about rain, so precipitation, temperature, other elements of climate are probably important with risk from lepto. I think most of us in this room who studied veterinary medicine were taught that lepto illness is typically seen in areas with high rainfall. Leptobacteria love water, like I said, and so if you look at a map of average rainfall across the United States, nothing too surprising here, the darker blue areas are areas that are wet. So we see the deep south and the Pacific Northwest well represented for rainfall as expected. And then on the other end of the spectrum, you have a lot of desert in the west and other arid areas. So the question is, does lepto actually line up with these maps of rainfall? Well, doesn't seem to be that way if you look at tests of dogs that have been positive for lepto. So these two maps give us two different windows into the world of lepto in dogs. This one on the left here shows what, let's call them hot spots, kind of up in the northeast and in the west. This is based on positive blood tests where the evidence of the actual bacteria were found. Over here, what you have is based on what's called serology. So this demonstrates prior infection. These maps, first of all, really don't line up with each other. You know, you see a stronger presence here in the west, a little bit of a different distribution in the northeast. So first of all, both of these tests can't be right. But either way, you still get a strong sense of it, at least in the northeast and in the coastal sort of lower west, and then a few scattered bits in the middle of the country. Both maps can't be right, but more to the point, they don't correlate very well at all with the rainfall map that I just showed you. So what my colleagues at EcoHealth, I wasn't actually involved in this study, but a couple of years ago, my colleagues decided to look at what do we think the areas of risk in the United States actually are, because the data just don't seem to be aligning. And so what they did was they looked at about 250 different potential variables, 250 what we call geo-reference data sets, so data like socioeconomic status and median income, the presence of human hospitals, the presence of veterinary hospitals, and also a lot of environmental variables like grassland cover and forest cover and shrub cover. And what they did was they identified which of all those variables, which ones were sort of most common in these areas that are red, so that they could then take those and extrapolate to the rest of the United States. So what were the variables that appear to be the most common in these areas where we know animals are testing positive for lepto? Well, there were a lot of them, but the ones that topped the list were all of these sort of interesting environmental variables, like forest cover and grassland and pasture. And what's interesting about all of these is that these may impact what happens to the rain after it falls. So it's not just that it rained, it's whether there was flooding associated with that rain. And that's, of course, impacted very much by the environment in which the water lands. So once we knew what these variables were, then we could then map them to all of the United States and try to predict which counties might actually be at risk of lepto, even though doctors might not be testing for it there. Those maps where you saw the red might actually represent a testing bias where doctors are sensitized to it. Maybe they've been better educated about it. Maybe it's a result of client willingness to pay for the test, but it's probably a biased map. So what happens when you create this forward-looking predictive map is really interesting. This is the retrospective map based on testing surveillance. This is actually the forward-looking predictive model. And so what you actually see here bears very little resemblance to where you see the positive test results. Here, where you saw the clusters in the northeast and the west, looks pretty different than what you see here, which is a strong presence kind of in the Midwest here, up and around Illinois. You see a lot less of it in the Northeast. The yellow coloring is sort of like middle of the road, but the red is where there's a really strong signal where you would predict lepto. So what you see now is kind of what you see here is a forward-looking map of the relative risk of dogs contracting lepto, rather than backward-looking at medical records. So they give you two really different answers. Maybe more interesting and more to the point is how then, when we take those environmental variables into account, does it impact the decisions we make as pet owners or as clinicians? And those decisions may have a lot to do with lepto vaccination. I suspect many of you who have dogs, your vets have talked to you about whether to vaccinate for lepto. So this is a map that's a couple of years old, showing the relative level of vaccination in each state in the United States. And here we have our map again, and you can see that this doesn't really line up with much of anything. The vaccination doesn't really line up with our predictive map. It doesn't line up with the test results map. It doesn't line up with the rainfall maps. And so the kind of work we try to do at EcoHealth is to show how all of these different variables, including the environment, can not only help us understand the dynamics of infectious diseases, but can help us make better intervention decisions. So you can see similar trends play out with other infectious diseases. This is a map from a 10-year-old publication that some of my colleagues at EcoHealth worked on. And if you looked at the reported occurrence in public documentation of infectious diseases around the world, you see these clusters in the eastern United States and all over Europe, but you see very little in South America, in Africa, in Asia. It just doesn't really make sense when you think about it, right? What this is a reporting bias map. So much like the dog test results in lepto were the result of a reporting bias, these are also the results of a reporting bias. If you correct for that bias and you look for all those kinds of variables that we were just talking about, the environmental variables, biodiversity variables, land use change, you get a very different map. This is a recently updated map by a number of the same people who did that first one. And where are the hotspots? The hotspots are across Central Africa, they're in Southeast Asia, and they're in South America. It doesn't mean that you can't have outbreaks along the east coast of the US or in Europe, but the relative risk of emerging infectious disease is most likely to come from this band down here. So what we like to do at EcoHealth is to use this kind of science and then take it to the next level and try to inform good policy decisions with it. So this came from a couple of my colleagues who pulled together all of these sort of different risk factors for what might cause diseases to emerge in those places on the map that I just showed you. And many of them are environmental. You know, have areas been deforested to make room for crops to grow? Has the climate changed? Is there a large trade in bushmeat? Has the agricultural industry made changes? Maybe there, you know, is there a greater intensification of livestock husbandry, or less of an intensification? Are animals grazing on the land more? All of these things can really impact the risk for disease emergence. And what some of us, including myself, are doing now is doing an analysis of that global landscape to try to figure out where are the gaps. You know, everyone's worried about the next big pandemic, and there's a lot of resources going into trying to prevent that. But are we looking at all of the potential factors? And what we found is that one of the main areas that is not being considered and the stakeholders who are not being brought to the table are the environmental stakeholders. So we have a long way to go to bring all the right people together before we can feel that we've really reduced the risk for global pandemics. And this is just a small list of examples of some of the different organizations we work with. They include ministries of health in countries around the world, right up to federal agencies and global organizations that are all dedicated in some way to human, animal, or environmental health. So I know I'm at time. Is it all right to show the video, or would you rather? So I've got a short 4 or 5 minute video here that's, it's a little bit of an advertisement for EcoHealth Alliance, but I think it really drives home the point of how important that environmental connection is. And it's some nice footage of the work that we do in Malaysia. We work a lot in Southeast Asia, and we have great partners with Malaysia, and we put together this short film.
Once a pandemic's emerged and it starts to cause a global outbreak of a new disease, it's really too late. You're really putting out a fire. What EcoHealth Alliance is trying to do is to stop them emerging in the first place. We know where they come from, we know why, and we know how to do that. EcoHealth Alliance uses a One Health approach. What this means is there is only one health. There's no separate health for people, for wildlife, for the environment. We're all connected together. We've been working in Malaysia for nearly 20 years, trying to understand why it's suffered from a series of outbreaks. What are the big pressures there on the land and on the environment?
Malaysia is considered one of the hotspots for biodiversity and also a center for illegal wildlife trade. So it's very important to not only protect the wildlife in this region, but also we will be able to stop any outbreaks from happening, from transferring from wildlife to humans.
We value our work with partners around the world. In Malaysia, we're building a development health research unit with the University of Malaysia Sabah, where we're training faculty from medicine, economics and life sciences together to understand how complex impacts on the environment affect health. We're working with local communities to help them understand the whole picture around the forest. What are the benefits of preserving patches of forest versus the economic benefits of growing crops instead? We teach them about the health impacts when you cut down the forest and try and show them that in some cases it's good to preserve them both for conservation and for their own health.
In Pakos, it's really important to educate the communities, especially the children, because they are the ones who will continue to preserve the area.
EcoHealth Alliance is working on the ground around the world to get between you and the next Ebola, the next Zika virus, and stop it before it emerges.
Just acknowledgement. So all the colleagues who helped me put this together, some of whom you saw in the video, we're a group of about 50 scientists, and we work as a team, and it's really okay. You don't have to run through the whole thing now, but and with that, I'm happy to take questions, but I think it's time for Dr. Callie to talk.
Dr. Paul Callie. Paul was an intern here. I actually challenged him with that notion. 1983, probably one of the best intern classes. I think it's safe to say that Paul's been with the Wildlife Conservation Society for 3 decades. Would that be about right?
I'm sorry.
Have you been with the Wildlife Conservation Society in its 40s?
1989.
Yeah, so just a sizable chunk of time. Paul's got a wealth of experience in One Health diseases. We're delighted to have him complement Sally and Ellen's talks. Thanks, Paul.
Great, thank you very much, and thank you for having me, and it's fun to be back. I had many lectures. I was on the receiving end in this room. I don't think I ever presented here. If not, it's been a very long time. So I'm the chief vet at the Bronx Zoo, and that's our home base for WCS. And we're dedicated to the conservation of wildlife and wild places around the world. And we're based at the Bronx Zoo, but we also run 3 other zoos and the aquarium in town. And we've got lots of animals, lots of species, lots of visitors, and lots of employees. And we also run 500 or 600 conservation programs around the world dedicated to saving half of the world's biodiversity. And so we are a truly global organization, and it's kind of within that context that we actually developed the One World, One Health program in the early 2000s, and that preceded the One Health and One Medicine programs. And the basic premise was, the pathogens don't discriminate. They infect whatever they can. It's people who create these silos of, the conservationists look at the wild animals, the public health community looks at, the people, and then the domestic animal veterinarians, the agricultural veterinarians concentrate on those agricultural species. But the pathogens, don't abide by those silos, and they go wherever they can. So we held this series of symposia through the 2000s, bringing together people in many countries from those different sectors so that they could benefit from the knowledge that could be shared. And the reason for that is, as you can see, most of these infections, we talked about avian influenza, we talked about rabies, most of those infections will affect all those people, wild animals, domestic animals, indiscriminately. And it also has a huge global financial impact. These tens of billions of dollars in economic costs of some of these outbreaks. And the big ones are people. SARS is an infection of people, foot and mouth disease of cattle. And so the economic impact in those sectors has really driven a lot of funding and attention to human health and domestic animal health. And we originally got into it for conservation purposes. And in these graphs that you see, nobody ever itemizes or puts financial figures to the cost for the world's biodiversity or the conservation impacts. And so has been always our focus. And I'll just give 3 examples tonight, 1 local, and then 2 global, all viral infections. And some of you may recall in 1999, there was this outbreak in New York City. Birds were dying. It started in Queens. It was primarily crows, spread through New York and ultimately to the tri-state area. And at the same time, there were human encephalitis cases that were happening in people in New York City. And it was viral encephalitis in all those cases. Later on, birds in our parks at the Bronx Zoo and the Queens Zoo also began dying of encephalitis, and then horses on Long Island also started dying. And at the time, it really preceded the One Health, One Medicine, One World Health movements. And the public health veterinarians were concerned about the people, and they were too busy to deal with the birds or the horses. And the equine vets really couldn't be bothered with the crows, and it was unfortunate with the people. They were concentrating on the thoroughbreds. And we were worried about our birds and the wild birds. And it really was an example of those different communities not talking to each other and not sharing with each other. And we're way beyond that now, and the West Nile outbreak, I think, helped move that along, because the CDC initially diagnosed this as St. Louis encephalitis, and that was based on blood tests. And the virus was actually first isolated from one of our flamingos that was sent to the National Veterinary Lab, because it's really easy to grow the virus out of birds. It's really hard to grow the virus out of people and horses. And so our bird samples were very rich sources of virus. and the virus that was isolated at the National Veterinary Lab was sent to CDC and correctly identified as West Nile virus, and it was identical to a strain that had happened in Israel. And some of you may recall, if you were around here then, that there were actually planes and helicopters flying over New York City spraying malathion to control the mosquitoes, because the mosquitoes were the vector. And the initial confusion in diagnosis was based on the serology, which is measuring blood antibody tests, because St. Louis encephalitis and West Nile virus are related viruses. So they cross-react on the serology, which is the blood antibody testing. And so since West Nile virus was not seen in the Western Hemisphere, when the test turned up positive, it was assumed to be St. Louis encephalitis, which is found in the United States. But the key for us and our pathologists was St. Louis encephalitis doesn't kill birds and doesn't kill horses. So very clearly there was something more going on than a human St. Louis encephalitis outbreak. We got a lot of press once we kind of unraveled this story, because it was kind of our veterinary pathologist, Tracy McNamara, who some of you might know, was the one who collected those samples, had the knowledge and thought that this didn't add up because St. Louis doesn't affect horses or birds, and so she was actually the first one who submitted those samples and allowed the correct diagnosis to be made. And in the years since, that West Nile virus infection has spread across all of the United States, up into Canada, down into Mexico, and it's actually had population level impacts on native bird populations, especially the crow and the crow family, and some birds of prey like snowy owls are very sensitive to it. So our contributions were that first live virus was isolated from one of our birds, and understanding what was the problem really benefited, the people of New York City as well as domestic and wild animals. And the very first equine West Nile virus vaccine that came out was actually derived from that viral isolate that was grown at the veterinary lab. So it's really a one health, and we like to put it in the context of one world, one health, because of the conservation impacts. And here you had this one viral infection impacting that broad suite of species. The second topic I'll talk about is Ebola. And Ebola, you read about in the papers, is a horrible viral infection, a very high mortality rate in people. A lot of people, when there's an outbreak, a lot of people get fatal infections from it. What's less well recognized is gorillas and chimps die of it also. And it's had population level impacts across the Congo Basin in the populations of gorillas and chimps. And through our work there, it became very clear that the primates in most cases were dying before the people were, and bats are suspected as the intermediate host. And a lot of this was actually unraveled when Billy Karish was with us at WCS before he moved to EcoHealth Alliance. You saw his name in the acknowledgments in the previous presentation. And so working in the Republic of Congo, there were these clusters of wild animal deaths before the real peak of the human illnesses and deaths that occurred there. And so what we do in Congo is we work very closely with the local communities to share information about the source of Ebola virus, and that it comes from bats, and it comes from gorillas, if gorillas die of it, because in that country, if they find a dead gorilla, they'll butcher it and eat it, and that's one of the ways that it can be introduced to the local community. So by educating the local communities about the risk factors, we can protect them. We also work very closely with Doctors Without Borders and other public health organizations, because they're the specialists in human health, we're not. And because it's suspected to be bat-borne, and this is a hammer-headed bat, a gorgeous bat species that's very common in the area, we're collaborating with NIH, looking at the movement patterns in these bats bats, sampling the bats for Ebola to try to see if we could unravel why these outbreaks occur and what we could do. We've also developed and helped to develop and deploy rapid field tests that can be used to make a diagnosis in the field without the need to export samples. And we're hoping through a better understanding of the epidemiology, we can help protect the gorillas as well as yield information that can be used to help people and prevent the infection in people. And the last infection we'll talk about are the influenza viruses, and you've heard a little bit about this before. Lots and lots of different types of influenza viruses. The ones that have the greatest risk to people are the viruses that infect poultry, swine, and people. And you hear about the risk of human pandemics like the Spanish flu in 1918 when millions of people around the world died. And the nightmare scenario is you have a virus like H5N1, and that's derived from birds, that rarely infects people, usually kills them if it infects them, but doesn't spread person to person. And that's compared to H1N1, which is largely swine derived, and that easily spreads person to person, but doesn't usually kill them. And so the nightmare scenario is you have a mixture, which is called a viral reassortment, between these two viruses or similar ones that will create a virus that's easily spread person to person and kills a high percentage of people. And H1N1 broke out in 2009, and in 6 months it spread to over 200 countries around the world, and tens of millions to hundreds of millions of people are thought to have been infected globally. And if that virus had the pathogenic potential of this other influenza virus, there would have been tens of millions of people potentially died. And the viral reassortment is really very interesting. So you've got influenza viruses that affect primarily people or birds or pigs, but then they can cross-infect. And when they cross-infect, the virus comes apart and then recombines and comes out as a new virus. So you start out with, a blue virus, a black virus, and a red virus, and after passing through and sharing viral components in the other species, you can end up with a combined virus, and that's the reason people are concerned about influenza viruses and their pandemic potential, and why it's really hard to predict every year. Every year they kind of have a best guess as to what that seasonal flu is going to be, and they produce tens of millions of flu vaccines based on what they think is going to happen, because they can't predict what's happening in this area, so you don't always have a good match. And so many times these influenza viruses emerge out of Asia because you got tens of millions of pigs, poultry, and people sharing those influenza viruses, and the great potential to have a highly pathogenic strain coming out of there. So get your flu shot. It's that time of year. Protect yourself and your families. And another project we got involved with, and again, this was when Billy was with us at WCS, is we participated in this global avian influenza surveillance network, and it included conservation organizations like us, public health agencies like CDC, animal agencies like USDA, and it was looking at the spread of influenza viruses around the world. And we learned a lot from that study. The assumption had been these wild birds on their migrations were spreading the influenza viruses all over the world, and the wild birds were spreading it to poultry. And what we found was actually usually the opposite, that poultry spread the virus to wild birds, and day-old chicks in the tens of millions are shipped all around the world for the poultry industry, many, many countries, and it's that global spread through poultry that really was the way those poultry viruses get around. And so through that GAINS project, lots and lots of samples run in labs all over the world, lots of people trained, and it ended up over 100 million data points in the database. And as a, the goal was to understand avian influenza epidemiology, which it did, but it also yielded us a better understanding of migratory bird routes because a lot of assumptions about migratory bird routes were not based on bird studies and as part individual bird tracking studies. So as part of this project, individual birds were banded and they were and some were radio tagged so they could be monitored around the world where they went to give us a better idea of where those birds went. And the bird migration routes didn't actually overlap the outbreaks that were sequentially happening around the world with some of those human influenza outbreaks. So that's a little overview of some of the One Health viral infections that we're working on right here based at the Bronx Zoo. Through our international programs, we're working in a lot of countries around the world, but we're also working closely with our partners like Sally Slavinski at the Department of Health. We still work with EcoHealth Alliance and still enjoy working with Billy when the opportunity presents itself, and also work with local human and animal health, New York City, New York State agencies. And I'm happy to answer any questions people might have in whatever format you want to go ahead.
So I think we can start, these were terrific. I think we can start with questions that you... Pardon? Okay. When do you want to take audience questions? Okay. So why don't the panel sit here? Okay. Okay, so that was terrific. A few potential questions. I actually wrote down some questions. I'm sure the audience has some questions. I think you guys did a wonderful job to identify why One Health is so important. I don't think there's any unclarity about that. This is an opportunity maybe to ask each of you what you do with regard to One Health, how you most excited about, or what is it that you do with One Health that you think fits most closely to this definition. We can start with Sally.
I mean, I think in my presentation, I think I tried to get at that in terms of my day-to-day role. I think a lot of what we do it's very human-focused, but we try to work very closely to appreciate, understand, and stay in constant communication with folks in the animal health world. And that encompasses, like my colleague said, all realms of animal health, right? So we're talking about domestic animals like you would see. We're talking about wildlife. We're talking about captive animals. We're talking about rodents. We're even talking about our agriculture. And so for my day-to-day role, One Health encompasses being able to work with these valued colleagues that are in the animal health world. Not enough focus on environmental health, but we're trying to work on that.
So how can you get into environmental health in your organization?
Well, we have a whole bureau dedicated to environmental health. We're in different buildings, but we've just started doing some collaborative meetings where since we focus on infectious disease, we want to see how can we start looking at our data and how can we collect our data to show impacts of climate change on human health. So kind of starting and moving to see from a surveillance perspective, what can we do at a local level to kind of show some impacts.
Is it working?
Just starting. I think for some chronic conditions, it's definitely clear, but in my realm of infectious disease, it's going to take a little bit longer.
So what are the impediments to that? Because what could be, well, there's a lot of things that could be more important than something, but infectious disease, as you all have shown or commented on, has amongst the greatest risks to the population, right? Whether it's influenza, flea, tick, arthropod, transmitted diseases. So it seems like a slam dunk, but why isn't it always like that?
Oh, well, there's lots of money in human health. Tons of funding in human health. I can't say tons. We could always argue we always want more. But there's hardly any infrastructure or funding when it comes to animal health and environmental health. And so that's in my mind, that's the biggest barrier. We just don't have enough funding, enough recognition, or infrastructure.
What would it take to get funders, politicians, government to wake up?
I wish I knew. I don't know if you guys have.
Well, I can simply offer that that's part of this analysis that I alluded to that we're doing at EcoHealth. We're working on it, in fact, in coordination with the World Bank. And part of the reason for that is to raise the profile. It's not an environmental health study, it's a global health security study, but we really emphasize in it the importance of environmental health and how it's just not an equal player on the global stage right now. And if you can get, if you can get platforms like the World Bank, or if you can get groups like the World Health Organization to just even have a session on it, at an annual assembly, it can make a big difference. So what we're trying to do is at a bare minimum to raise the profile, but also to show what the stakes are if we don't succeed in bringing the environmental sector to the table. And I do think that showing the links to climate change and infectious disease might be one of the best ways we can do that, because I think most of us understand now the importance of climate change in our lives, and it's part of our job, I think, as health professionals to educate about the potential negative health impacts and negative economic impacts of climate change, and that might help rile folks to come to the table more.
Paul, what do you think?
Our focus is our animals in our zoos and aquarium and our conservation projects around the world, and so kind of that's the lens that we look at the One Health activities. And we're not experts in human medicine, we're not experts in domestic animals, so we very much partner with those that have complementary expertise. And our biggest challenge is because of the economic impact to human health and agricultural animal health. That's where the majority of the government funding goes, and so we really struggle for conservation funding to fulfill our perspective on the One Health activities.
It seems that with environments suitable to sustain animal populations throughout the world, we see that in Africa, for example, how the forests in South America, how the forests are chopped down, how grazing land is encroached on by people settling, how slash and burn opens up farmland, etc. And then there's the strain on herds and populations of mammals particularly, which then become more susceptible to diseases because of smaller breeding stocks. There's a lot about conservation, you see it in snippets, but to me it seems like, I always wonder why more people don't just get that religion, and see that there isn't, how many years are there before you lose dozens of species? I guess there's so much geopolitics involved, because you do X and then there's not enough Y for people who are, looking to survive, make farmland. But I wonder if there's, I'm sure you all have discussed this or attended meetings, is there a strategy that might help what is already going on with that regard? Do countries, are certain countries motivated more than others to make a difference? And if so, what is it taking for those countries to actually, make that move?
Yeah, it's really challenging because a lot of it is about people's livelihoods, and they don't hate nature, but they need to feed their family and take care of their family. And so the challenge is finding ways that you can meet people's needs and still preserve the environment and the animals that are there. And that's very difficult. I mean, Manhattan used to be a hardwood island. It's been a long time since that was the case. And, you know, so as Americans, when you go out to other countries and you say, oh, you should protect this land, but, you know, we exploited our natural resources to become a wealthy, successful country. And so you have to, and, you know, we were responsible for the extinction of the passenger pigeon, Carolina parakeet, almost the American bison. And so, you know, it's a challenge to find ways to support, for us, to support conservation and preservation of wild areas while still working closely with communities that they can have livelihoods and sustain themselves.
Yeah, I think the challenge is to find ways to make an economic case for conservation, you know, that's something that I think both of our organizations are working to do. It's not always easy, but I think that there are cases when it actually can be to a developer or a company or a farmer's benefit to look at things more with an eye toward conservation than perhaps that they had. The other example that comes to mind for me is I think it's easy for those of us in a well-resourced society, which we all live in, to think that we are better able to address the problems of human and animal and environmental health than perhaps some in the developing world are. But I've actually found that in some ways the opposite is true, and smaller, less resourced countries can be more nimble even than the United States. We have a huge government with a lot of entrenched moving parts. And we work a lot in Liberia, which was one of the countries that dealt with the West Africa Ebola outbreak of 2014 to 2016. And they've recently, along with some other African countries, established a One Health coordination platform. And they're essentially structuring their entire government to come together in One Health fashion. And that includes their Forest Development Authority, it includes representatives from the private sector, from the health ministries, and it's really forward-looking, and I think that is that's the wave of the future, because it's countries like that that really exist in that belt that I showed you of high potential risk for emerging infectious disease.
I keep coming back to, of all the issues, infectious disease, which you can't escape. I wonder if, like, the world has been lucky, quote, no one is alive anymore that went through the Spanish influenza from the beginning of the 20th century. I mean, 5 people. So that's not in anyone's, who can relate to that? Smallpox, at least in, you know, that's gone. All these scourges that slaughtered people, many other ideas. So it seems like all these infectious diseases are maladies, but somehow they have not really blown up to where it's created a real population issue. Not enough for the people to squawk, right? Not enough for the politicians to find ways to spend money. I mean, it's not to say that won't happen. Hope it doesn't, but of course, getting ahead of it before that happens is a challenge, as I think each one of you has shown. So is there a way, do you think, with all of the threats, is there a couple of these diseases that you could use as like sentinel diseases that you could do enough work in to have world application that wouldn't cost, it was reportable. I know that sounds bogus, but like of all the diseases, some are hard to diagnose, some are hard to assess, some are not that hard. Are there any conditions of what you all talked about that might be good prospects to develop further, and they'd be non-political and they might get wide acclaim, if that makes sense? Rabies. Is rabies enough of a problem? It's obviously not enough of a problem for the United States to go crazy. I mean, not as an entity, right?
Well, I mean, within the United States, there's been amazing work done within the United States to essentially, we've eliminated the canine variant of the rabies virus within the United States. So in 2004, we declared the U.S. to be free of the rabies canine variant. And why that is so important is that, globally, over 55,000 people still die of rabies every year. And most of those cases are occurring in places like Africa and Asia where that canine variant still circulates. What that means, the canine variant, is the virus, this rabies virus, adapts very well to certain animals. And so the canine variant has adapted well to dogs. And so it gets transmitted very easily from dog to dog. And so in those areas where you do have the canine variant present, people are more likely to interact directly with dogs on a regular basis than they are with wildlife. In the United States, it's wildlife that are the reservoir. So that's where we're still seeing people dying on a regular basis from rabies, even though we have these amazing, great biologics to actually prevent and control it. So I think on a global scale, there's been a lot of focus, resources that are put into trying to vaccinate dog populations, similar to what we did in the U.S. Animal control and a combination of rabies vaccination of dogs was how we were able to eliminate it. Down in Central and South America, they've done an amazing job. We almost don't see any more canine cases occurring there. And so if we can push that effort forth in other places, hopefully we'll see the same thing.
I think the problem you identified is a serious one, because we were lucky enough to live in a time when most of us don't remember smallpox. We don't remember the 1918 flu. We don't remember the Black Death of the Middle Ages. And so even though there are these outbreaks that percolate around the world, for the most part, we're pretty well insulated from them for lots of reasons having to do with the advent of vaccines and tremendous advances in public health measures. But the reality is there will be a major outbreak at some point. I mean, there absolutely will be a pandemic of something. So the question is, what will it be and where will it be? So I think that one of the things that we could probably do better, instead of our governments being reactive to the next outbreak, to actually really try to put resources into prevention. And that's hard when you don't know what the next outbreak is going to be. These emerging infectious, no one really predicted what would happen with the Zika virus just a couple of years ago. However, economically, there's so much bang for the buck with prevention compared to response, 100 to 1, 1,000 to 1, it depends on what you read. So I think that if we can work on understanding what are the most likely viruses to cause a pandemic, and that there's a lot of good work that's going on right now, including with the Wildlife Conservation Society, that might be a way to convince policymakers that these are the things we should invest in, because there'll be a good likely return on that investment.
And there are some efforts trying to identify the next thing. I mean, you guys do some, with your modeling and looking at places of the world, and there's a government-funded project called Predict, which is sampling wildlife all around the world, trying to detect new viruses, and there's talk about a global viral genome project to also kind of look for the next big thing. The problem is when there's an acute urgency, when there's a pandemic or an epidemic, that's when everyone focuses on it, pays the money, and prevention is so much more cost effective, but it's boring. It doesn't get the priority that an emergency response.
Yeah, in my recollection, Ebola comes up in that regard, right? I'm not sure if there was another recent world crisis, Zika a little bit, but you didn't die from Zika right away. Ebola. Remember, we had all that hype, people coming into the country, paralyzed world travel for a while. And where is that now? It's gone. Yeah, hasn't gone away, but
That particular outbreak is over, but there are others happening right now in the Democratic Republic of Congo.
yeah.
But they've also now developed a pretty good human vaccine for Ebola that they can use in the face of it.
Which was developed as a result of the outbreaks instead of in advance of the outbreaks.
Yeah. So I was lucky, because many of these diseases, there's really no vaccine. That's very well, but it's very HIV is a good example of a disease that has thwarted prevention, and I mean, there's little bits of improvements here and there, but it's taken quite a long time and it's still not where everyone would like it to be.
And it's interesting that that's a zoonotic disease. It is a primate disease that entered people because people were hunting and butchering and eating monkeys. That's where HIV came from. It actually started in the non-human primates.
Which they're still doing. Okay.
So we're going to take some audience questions now. I'm just going to go around with the mic, and if you could wait until the mic comes to you to ask your question so that we can capture it for people viewing at home. So who has a question? All right, right here.
Hi, I have a question about rabies. I live in the Bronx and there's lots of raccoons in my neighborhood, and I'm wondering if you have plans of dropping those little packets of vaccine in the Bronx, because you said before that they were in some of the boroughs, but not all of the boroughs.
Correct. That's a very good question. So the project that we're doing where we're dropping those baits, there's very limited funding available for that. And so we can only do it, we can only get a limited number of baits, and we only have a limited number of resources in order to actually distribute those. So for right now, the focus is actually on Long Island, including Brooklyn and Queens, and then Staten Island, because they're islands, and the hope is that over time we can eliminate the raccoon variant from those islands. And then in the bigger plan, once that happens, then start moving through Bronx and then up into the rest of New York. Now, we don't know if that will ever happen or how successful, because it is dependent upon funding resources and whatnot, but in the bigger plan, that is the hope. But until that time, I'm sorry, you will continue to have rabid raccoons.
All right, next question. I thought I saw one back here. No? Anyone else? All right. Oh, right there, sorry.
Hi, I have two questions. One, why are certain diseases returning? I read about the polio in the children and measles and the adenovirus, and like, why are these diseases not wiped out? Why are they coming back? My second question, what can we do in New York if there's some kind of pandemic, like besides panic? Like, is there something that the governor or the mayor are going to do? Like, how can we protect ourselves?
So I think when you're mentioning the polio virus, so what has been happening in the United States, it's a polio-like syndrome that's affecting these kids. I think there's been like over 300 cases reported so far in this season. And so the problem is they haven't really identified a true etiology with it. So in terms of why is it coming back, well, we don't even know what it was to begin with, but there's a lot of work being done right now through CDC and a lot of different health departments where they are identifying kids that have been impacted to see if we can figure out, you know, what is causing this. It seems like a lot of these kids start with some kind of respiratory infection to begin with, and then, you know, a week later present with this, you know, a paralysis of upper limbs, lower limbs, sometimes a combination. And it's really been frustrating because there really is no idea or good idea of what it is or why it's happening. Is it a true direct invasion of some kind of virus into the nervous system? Is it an autoimmune response to the original infection? So a lot that has to be done to try and figure that out. So that maybe it's newly emerging, maybe it's something old and it was just not recognized before, but still a very big curiosity that a lot of people are trying to work on. Measles, so all the reports that have been coming out in New York are related to the outbreak that's going on in Israel. So there's a big outbreak there right now, and there's been travelers that have been going back and forth, and the communities that have been traveling is where we're seeing the outbreaks occurring. So people infected that have been to Israel coming to Rockland County upstate and then in the Brooklyn area, and there's a lot of congregation going on among younger kids. There's very good vaccination rates there, but maybe the kids that are getting infected are the ones that haven't necessarily been vaccinated yet. So, that's always going to be a problem. The concern about not having good vaccination rates, but that doesn't seem to be applying here. But on a global scale and across the United States, we certainly are seeing an increase in the number of vaccine-preventable disease because there's more resistance to vaccination. In terms of preparedness, so there's a lot of money being put into preparedness. There's a whole emergency management office within New York City, and then in the New York City Health Department, there's the Office of Emergency Preparedness. And a lot of their work is really just trying to work with healthcare facilities, healthcare providers to help recognize and triage and treat folks who may come down with the next strain of pandemic flu, and identifying resources and ways to manage a big outbreak in the city, like big discussions about, do you shut down schools, do you shut down the subway, depending on the extent, putting out pods where people can come and get antivirals if necessary and things like that. So there is a lot of work being done. I'm not necessarily involved in that, but there is a lot of preparedness planning, particularly for flu.
If I had to be in one place in the United States when there was going to be a pandemic, it would be New York City. New York City is better prepared than any other jurisdiction in America, I would say, for a major urban outbreak.
I've run into several people lately who have been saying that they feel, or that they've read, that our pets, particularly dogs, are way over-vaccinated. Is there going to be I don't know what your thought on that is, and if you feel they're over-vaccinated, are they going to change the immunization schedules?
Yeah.
Well, that's a really good question. It comes up a lot. And it's really parallel to the same question that humans are asking. Should I vaccinate my children for measles or scarlet fever or what? I mean, I think that overwhelmingly, and I hope I don't offend anybody, but overwhelmingly throughout the world, the evidence is very strong that vaccination is the way to go to try to tamp down many infectious diseases. Not that it's perfect, doesn't guard everybody, and on occasion it can cause harm. But in light years, it's a good thing to do. Now in dogs and cats, there is a readjustment going on in how to deal with your pets with regard to vaccinations. Here's why. As recent as 15 years ago, veterinarians vaccinated dogs and cats with the same philosophy as they did when America was agricultural. Swine flu, all sorts of vaccinations for cattle. And what you did was you just vaccinated the heck out of them. And these animals were being born constantly, and it was just, in fact, these folks know, you look at these vaccination implements, they're these like paintball guns with zillions of vaccines in them, just boom, 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 boom. That kind of carried over, was a source of revenue for veterinarians, and in the 50s and 60s, veterinary practice revenue was largely associated with preventative care, of which vaccines played a big component, and flea and tick and blah, blah, blah. Well, fast forward now, it's increasingly appreciated that you don't need to give a dog a distemper vaccine every year of its life till it's 20, because the immunocompetency lasts for a long time. But that's also the rub, because animals are different, and while there are guidelines and groups of veterinarians and American Animal Hospital Association, Avian, et cetera, that try to get together to put together coalitions, there are a lot of aspects that have uncertainties. So it's hard to be dogmatic, and it leads to people being dogmatic. But I think nowadays, the majority of veterinarians in small animal practice are throttling back many animals with certain, you can assess immune status with certain conditions by drawing blood samples, and you might be able to avoid that, whatever. But that's not cheap. That's like, and if you have a lot of animals, it turns out that it's way cheaper. In fact, it's unaffordable if you were to get blood samples to get sent out to California to make sure that you did or did not. And so when that price comes down, I think that will help the process. What do you have?
I think probably the only exception to that is rabies because of the human health risk and the laws that are on the books and the requirements to quarantine animals after a dog. I mean, do you want to talk about the bite issues? Because
yeah, so the rabies laws say essentially you have to keep your pet vaccinated in accordance with the manufacturer's recommendations. And so the manufacturer's recommendations are, depending on the vaccine, it's either once a year, after they get the initial, it's either, and the booster, it's either every year or every 3 years. And so the guidelines really have to adhere to what the manufacturer says, because the manufacturer is essentially saying, this is for how long we know this vaccine can protect your animal. So that's never going to, well, I can't say it's never going to change. It's going to change if the manufacturers change. But to keep in compliance with rules and regs and the health laws, you have to keep your pet currently vaccinated against rabies, because if your animal is bitten by a rabid animal and they're not currently vaccinated, that animal can go into a lengthy quarantine that has to occur at your veterinarian's office or a veterinary office, and can be fairly expensive.
All right, do we have any other audience questions? All right, one in the front.
Thank you very much for this evening's discussion. As people who deal a lot with the USDA, I'm wondering if any of you have seen any changes in funding, actual funding or priorities of funding that deal with infectious diseases over the last, maybe 2 years or so, in terms of the monies that have been available or not for that.
I mean, I don't really know much about their overall budget. I do know that they have dedicated funds to a One Health component within USDA. So I know I've talked to veterinarians at USDA whose sole purpose is essentially to work with partners at the state and local level when it comes to identification of some kind of zoonotic infectious disease.
So with regard to USDA budgets, I mean, they've been getting the squeeze for the last several years in general, but it might be more clarifying to look overall at the bigger federal budgets that go into infectious disease. And NIH got a huge boost in the last budget. Department of Homeland Security spends a fair amount of money on infectious disease, including running a lot of the research that happens out on Plum Island, which is sort of a joint, it's a partnership between Homeland Security and USDA to work on infectious diseases like foot and mouth disease. And then, of course, there's been a huge infusion of money through the Department of Health and Human Services to create vaccines for people, to acquire those vaccines. There's a lot of talk about decreasing budgets for the CDC and what they have to do, especially globally. So I think it's more informative to look at overall trends. And I certainly think in the last 10 or 15 years, especially since the anthrax attacks and since Ebola more recently, you do see a relatively good commitment on the part of the federal government to pandemics and bioterrorism readiness, but possibly not where it needs to be yet.
I did a volunteer thing. The American Veterinary Medical Association has councils, and a lot of them are good. And I did a stint on the AVMA Council on Research. It was a 6-year deal, and part of that council include government agencies, including USDA. There was CDC, and there are acronyms in the government that deal with agriculture that you've never heard of. The military was there. The military is a very big supporter of preventative health and infectious disease. I mean, it's probably the biggest budget in the country, amongst the world. One of the things the USDA has been doing and continues to do to fund are proposals. Every year they send out a thing called RFP, Requests for Proposals. anyone who involves in research can get that website. And one of the big things they fund year after year is research with regard to E. coli. And you've all heard, you know, all of a sudden everyone's getting sick and some people are dying of acute kidney failure in Arizona, and they trace it ultimately back to a shipment of lettuce from who knows where. E. coli, salmonella comes up, and other microbial pathogens. Years ago there was mad cow disease. Food stuff. You remember, this is a ways back, but you remember it. It's not necessarily FDA, but a little bit. There were pet food contaminants from China, and you know, does anyone remember what that chemical was? Melamine. Melamine. Yeah. I mean, it took a long time for them, some time for them to find it. So, the agencies are very good, in my humble opinion, to step it up in the teeth of a crisis. And as panel members have said, it's a feature of humanity that the squeaky wheel gets the juice, and when things are going good luck getting funding, even for its superb, incredible preventative health. And I think that's all the folks here struggle with that, trying to get attention for doing things early on that may stave off issues.
All right, so those are some great questions, and I just want to wrap this up and thank all of our panelists and our moderator for being here tonight.